It's a very complicated area who should be tested for a hereditary breast cancer gene. Today we use panels, anywhere from 25 to 50 gene panels, which look at all the common and uncommon genes that have been identified that increase susceptibility to breast cancer. Of course, number 1 and 2 of those are BRCA1 and 2. Now we know that if you look for more genes and if you expand the criteria for looking at these genes, that we're going to find more people that have the potential for hereditary breast cancer, and they can be offered prophylactic options, whether that's surgery or increased surveillance or chemoprevention. So I think the American Society of Breast Surgeons took a very provocative stand, because right now, if you look at the guidelines, they're very confusing. And they're kind of arbitrary. Like NCCN says any patient under 45 should be tested, but only patients between 45 and 50 who have certain family history, and triple negative patients under 60. So it's very complicated, and it probably doesn't need to be that complicated. I definitely advocate for a broader testing. Now, whether we have to use our clinical judgment and whether or not we should test every 80-year-old diagnosed with breast cancer with 0 family history, I think we can leave that up to the doctors. But I strongly agree with expanding the indications for comprehensive genetic testing in patients with breast cancer.